The ACA Code of Ethics outlines clear statements regarding confidentiality, record retention, and boundary management. We must understand that privacy and confidentiality are foundation to the counseling relationship. It's important to emphasize that privacy and confidentiality are the client's rights, and it is our responsibility to uphold these rights. As counselors, we must clearly define that what it is that confidentiality entails, what it does not, and when we can maintain client privacy, and the circumstances under which confidentiality might be breached. Client records are also of paramount importance. With the advent of electronic records, we are able to store significantly more information in smaller spaces. However, many paper records are still maintained. As we diagnose and provide clinical treatment, these records become part of the individual's physical and mental health history and will follow them throughout their life, including any diagnoses or treatment information. This makes boundary management even more crucial. Today, we will continue discussing confidentiality, explore specifics regarding client record retention, and delve deeper into managing professional boundaries in the counseling field. When discussing confidentiality, it's essential to consider cultural competency in our approach. We must ensure that we have shared understanding and use emotionally intelligent communication when explaining what confidentiality means. It's crucial to have clear and explicit conversations with clients about when confidentiality applies, what constitutes protected health information, and the circumstances under which confidentiality may be limited. We should also assess whether the language we are using aligns with the means behind the information we are providing. I recommend encouraging clients to reflect on and communicate back what they've understood and what that means for them. Additionally, it's important to discuss who can be involved in the client's care. Informed consent plays a role in this, not just in terms of who can be involved, but also to what extent and the frequency of contact with those individuals. Consider how often we may need to interact with others who may have received client consent and what methods of communication are acceptable. For instance, can we email, send letters, or communicate via phone? When sending letters, do they bear the agency's name on the return address? If so, are there extra precautions we need to take to protect confidentiality? Some regulatory guidelines require us to remove identifying information in certain situations to safeguard a client's privacy. For methods like faxing or emailing, it's vital to ensure that we have the client's consent to share information and that we do so in a secure, encrypted manner to protect their data. Third-party information also requires careful consideration. For example, if we're handling urinalysis tests, such as that from Quest, we need to understand that the testing agency owns the information, and the client may give consent for us to access it, but we must be mindful whether we can share that information with others. Clients usually request copies of their records, but it must be done in writing and go through a formal process to ensure any necessary redactions in order to ensure that we are avoiding any harm. We also need to be mindful of the physical environment in which we conduct sessions. Hallway conversations or any situations where confidential information might be overheard should be avoided. When clients are in your office, ensure that you're not displaying any confidential information on your computer screen, particularly if it's visible to clients or contains information about other clients. In the office, any paperwork with identifying information should be filed promptly, as it's required by agency regulations. For in person counseling, ensuring privacy is crucial, especially if others are in the vicinity. Like we talked about, maybe even some soundproofing measures might be necessary to ensure that confidential discussions cannot be overheard by people in a hallway or nearby offices. For telehealth, it's equally important to secure patient portals and protect their confidentiality to ensure that you're in a private setting where family members or others cannot overhear or disrupt the session. Finally, confidentiality should be an ongoing conversation throughout the treatment process. We must continually discuss the limits of confidentiality with our clients, considering cultural meaning and how these may evolve over the course of their care. So, the counselor's role in confidentiality is to protect the client's rights to privacy, not to own the confidentiality. This means that we must prioritize the client's well being and ensure they are informed about limits of confidentiality. It is essential that clients feel empowered to make decisions about who can and cannot receive their information. Clients have the right to autonomy in this area. For minors under the age of 14, it's important to have appropriate documentation, such as guardianship or custody agreements, and to follow any relevant court orders. Sessions should be structured in a way that promote client autonomy, such as determining how much involvement a guardian has. For instance, a 12-year-old may spend the majority of the session alone, while the guardian may join for a few minutes at the beginning and then again at the end of the session. Consider how to structure your sessions to balance confidentiality with boundary setting. Client disclosures should only occur with informed consent when there is clear legal or ethical justification to disclose protected information. In emergency situations, like when we think back to the COVID-19 pandemic, some confidentiality restrictions may be temporarily lifted, allowing verbal consent instead of written consent to facilitate treatment. However, in most cases, best practice dictates that disclosure should only happen with a written informed consent. It is crucial to be aware of the exceptions and limits to confidentiality. When disclosures are necessary, ethical or legal justification should guide these decisions. In such cases, consult always with a supervisor or colleagues for guidance. As counselors are ethically obligated to advocate for clients and work to eliminate barriers and hinder the growth of their development. However, we must be able to use identifiable client information in advocacy efforts. We must obtain clients' consent while we aim to advocate for social justice and promote the growth of our clients. This may be done in a it has to be done in an ethical manner. If disclosing information is necessary, always ensure consent is obtained and engage in transparent conversations with the client about what that entails. Some clients, for example, may become peers or advocates within their communities and choose to provide consent to share their information for these purposes. Lastly, it's vital to continually address limits of confidentiality in an ongoing and explicit manner. Discussions should be culturally sensitive, ensuring both confidentiality and its limits are clearly understood by the client throughout their treatment process. Confidentiality is not absolute. When we discuss the limits of confidentiality, we acknowledge that there are times when breaching confidentiality is necessary to protect an individual's well being. These situations typically arise when a person may be at risk of harming themselves, others, or experiencing neglect. For example, if a client is expressing suicidal ideation with an intent, plan, or means, we are faced with a situation where the individual poses a risk to themselves. In such cases, we may be required to breach confidentiality if the client is unwilling to seek hospitalization or other appropriate interventions to ensure their own safety. Similarly, if a client has homicidal ideation, intent, or a plan, we have a duty to warn and take steps to breach confidentiality in order to protect others. In cases of neglect, such as child abuse or elder abuse, we do not have an obligation to investigate. We must report the situation as mandated reporters. When neglect is occurring, confidentiality cannot be maintained. Our primary responsibility is to safeguard the safety and welfare of everyone involved. Understanding when to breach confidentiality to protect individuals from harm is a critical aspect of our ethical duties. I would also like to provide further information on imminent danger and the steps we must take in these situations. So, here you can see that you can click into this link in the PowerPoint. And this tool is going to be helpful for assessing imminent need. It's based on the guidelines from the American Society of Addiction Medicine. It breaks down the imminent need into a profile for specific dimensions to really guide your evaluation. And it looks at the following areas: substance use or withdrawals. Are there signs of substance use or withdrawals? This is a simple yes no to guide your determination in this concern. Biomedical conditions or complications. Have there been any significant physical health problems in the last 24 hours? Are these issues affecting the individual's physical, emotional, behavioral, or cognitive functioning? Imminent danger of harm. So, does this individual show signs of self harm, harm to self, harm to others, such as suicidal ideation, intent, a plan, or a means? Are there homicidal thoughts, violent impulses, or behaviors? Next is ability to function. Is the person able to manage daily activities or take care of themselves? This can indicate a significant disruption in their ability to function at a basic level. Readiness to change. Does the individual appear to need specific types of treatment, particularly for substance use or mental health issues? While this tool is focused on addiction, it can also be helpful in assessing broader mental health concerns, especially in areas of imminent risk. Also, we want to know about relapse, continued use, or ongoing problems. So, are they currently under the influence? Is there evidence of relapse or persistent issues? For instance, are acute symptoms of mental health concerns or substance use exacerbating their risk to the individual or others in the community? A critical point to note is the concept of relapse. While relapse is often discussed in terms of substance use, when an individual returns to using a substance after a period of abstinence, it is important to broaden this concept. For example, if an individual with anxiety is told never to experience anxiety again, a reoccurrence of anxiety could be seen as a relapse. This highlights the need to shift the narrative and understand relapse as a common part of the recovery process, both in mental health and addiction treatment. Individuals may experience progression as well as setbacks, and it's vital to help them navigate these periods of regression in their treatment journey. In cases of imminent danger, ensuring the person's safety is a priority. Assessing the recovery environment and identifying additional support services is essential to provide the necessary care. Answering questions outlined in this tool can help determine whether immediate intervention is required and offering a structured approach to assessing imminent risk. This is just one tool in assisting our evaluation of whether an individual's needs are urgent or can be addressed at a later point in time. So, again, there are exceptions to confidentiality as they arise when sharing information necessary to improve services. This includes collaboration with interdisciplinary teams and supervision, as well as involving administrative support staff. These staff members are often gatekeepers in your office, and they are going to help ensure a smooth process for individuals entering care. It's essential to equip them with training such as mental health first aid to ensure that they can respect confidentiality. Additionally, many agencies use an umbrella consent model where clients consent to an agreement and acknowledging that their counselor may consult with supervisors and administrative staff to help handle insurance or other logistics tasks that may involve assessing the client's protected health information. In situations where couples, family, or group therapy, confidentiality can be more complicated, as you can imagine. When there are multiple participants, it's important to identify who's the primary client, and as this can differ in every situation. For instance, in family therapy, all participants may be considered clients, but in couples counseling, the identified client may vary. It's crucial to maintain clear boundaries and, if necessary, refer clients to specialists and marriage and family therapists to prevent potential conflicts of interest or ethical concerns. For minors, balancing confidentiality with the rights of the parents or the guardians can also be very tricky. The American School Counselor Association emphasizes the importance of maintaining confidentiality for minors while recognizing that guardians have a right to certain information. Establishing a safe place for the adolescent to engage in therapy while also navigating family involvement requires sensitivity to both the client's needs and the legal obligations. Court orders and subpoenas are another common area where confidentiality can be compromised. While subpoenas are frequent in the mental health world, they must be signed by a judge to be valid. If you receive a subpoena, it's essential to verify that it is legitimate and seek guidance from your supervisor, legal counsel, or compliance department on how to proceed. Any release of medical records in response to subpoenas should be supported by informed consent, ensuring that the client understands how their information will be used in legal proceedings. When preparing clinical documentation, always keep in mind that your records may be reviewed in legal context. It's important to focus on your clinical impressions, assessment, treatment approach, and progression towards treatment goals, rather than detailing personal conversations or informal reports. Documentation must be clear, professional, and focus on the client's treatment plan. When involved in court proceedings, remember that clinical records should reflect your medical necessity for treatment and be grounded in ethical practice. It's important to note that the requirements for court orders and subpoenas can be different between mental health and substance use facilities. In substance use treatment, a good cause court order is typically required to release information, and a subpoena alone may not be sufficient. Understanding these differences and the specific rules of your agency, particularly if you're involved in custody cases, is going to be absolutely vital. Always be aware of your role and consult relevant guidelines and professionals when handling legal matters related to confidentiality. As it says in this slide, document, document, document. As we've emphasized the importance of clinical documentation that supports goals, assessment, interventions, clinical impressions, and treatment plans, it's crucial to understand that if something isn't documented, it simply didn't happen. In the field, you may find yourself with a packed schedule, back to back appointments, limited time for documentation. However, it is essential that you prioritize documentation and seek support to be able to make time for it. One way to handle this is by incorporating concurrent clinical documentation during counseling session. This approach allows you to document the session while engaging the client, making the documentation part of the therapeutic process. For example, you can review the progress since the last session, ask the client about their goals for the current session, and discuss their perceived progress. This not only helps with productivity, but it also engages the client in their own treatment, aligning with the principle that the client often prefers to be involved in decisions about their own care. Remember, nothing about me without me. If clients express concern or suspicion about the documentation, be transparent and collaborative about this process. This shift in the field's paradigm towards documenting in session can improve productivity and make documentation process feel less oppressive, turning it into a therapeutic tool instead. In many medical settings, documentation is happening in real time during the appointments, and our clinical work is increasingly aligning with this medical model. Embracing this shift can help you meet the needs of your clients more effectively. Of course, in certain situations, this may require flexibility. For instance, working with a paranoid client may make it inappropriate to document during session, so you may need to adapt based on the individual's needs. Regardless, it's essential to ensure that documentation is timely and complete. If documentation isn't signed by the client, it's not considered valid. Most often, clients will need to sign encounter forms confirming that the services were provided, including the date, start time, and end time. Ensuring this accuracy and documentation is vital for meeting both ethical and legal requirements. When considering the retention of client records, it's important to think about what happens with these records as treatment comes to an end, or when a client has been in treatment for a prolonged period of time. First, we need to consider the timeline of informed consent. Typically, the consent forms completed at the initial intake or the assessment are valid for 1 year. If a client remains in treatment beyond a year, we update and revise those consents. Ideally, we do this annually. Additionally, it's important to discuss with the clients whether they would like any changes regarding who their information is shared with, and this should be part of our regular practice. Clients who have the right to revoke consent at any time, and if they choose to do so, it must be documented in writing. It's essential to check with your agency's policies and procedures to ensure you understand the specific standards around the lengths of consent and how revocation is handled, especially for mental health. Regarding the retention of records, the standard practice is to retain records for 7 years following the last day of services for adults. For minors, records must be kept for 3 years after they reach the age of majority. For drug and alcohol treatment records, retention period is 4 years. In cases where there is follow up contact in the client after the last date of service, such as aftercare or outcome measures, records may need to be kept even longer. Specifically, drug and alcohol regulations require follow up, which serves as the reference point for the yearly retention of records from that time forward. Next up, we need to talk about boundaries. Boundaries are going to be very, very important, and we need to know our boundaries. So, when considering all these factors, we need to know what our boundaries are and how to manage them effectively. As you can see, there's a lot to consider, and this is not something we should take lightly. It's essential to maintain healthy and appropriate boundaries in our clinical relationships. When we talk about boundaries, we generally understand that professional boundaries entail what's appropriate and what's not. However, it's important to differentiate between boundary crossing and boundary violation, as these are two distinct concepts. Boundary crossing refers to an exception to a commonly accepted practice made for the benefit of a specific client in a particular situation. Examples of boundary crossing may include physical touch or donations. For instance, in drug and alcohol treatment, particularly in 12-step programs, there may be frequent hugging or physical touch, and it's important to discuss what is appropriate in these contexts. In professional counseling, touch is seen as maybe a brief shoulder tap or offering a tissue to a client when they're crying may be comforting, but we always must be mindful of the power differential. If such gestures are made and the intent is to benefit the client, they can be viewed as acceptable exceptions to the typical professional practices. For example, if a client loses everything in a house fire, the agency may collect donations such as clothing to help them, which is boundary crossing done for the benefit of the client in a specific circumstance. On the other hand, as we see here on the slide, boundary violation is a serious breach that causes harm. Examples of boundary violations include engaging in sexual relationships with client, becoming romantically or personally involved with clients, or accepting extravagant gifts. If a client offers an overly generous gift, such as a high value gift card, it's important to set clear boundaries and decline the gift, as such actions could lead to ethical issues. Many agents have policies regarding gift giving. If your agency does not, it's important to advocate for the establishment of such policies. During the holidays, clients may offer cookies, donuts, flowers as a gesture of appreciation. In these cases, I recommend sharing these items with the entire office to avoid any appearance of favoritism or boundary violation. By sharing these items openly, it ensures that the gesture is not seen as a personal one between you and the client, but rather as a communal offering to the entire agency. Unprofessional relationships, including dual relationships and sexual relationships, should be avoided at all costs as they represent a slippery slope that can lead to misuse of power and potential exploitation of clients. It's important to remember that professional counselors, we operate from a position of power, entrusting the welfare of our clients within our offices. This power differential makes it essential to maintain clear boundaries and to avoid any ethical violations. Dual relationships, multiple relationships, and sexual relationships create significant risks of ethical breaches, and it's crucial to avoid these situations. Sexual dual relationships, in particular, involves an abuse of power, betray of trust, and unethical behavior. These relationships are not only harmful to the client, but also illegal in many states. It's important to recognize that engaging in such behavior can have serious legal consequences and damage professional relationships and reputations. Sexual misconduct remains one of the most common allegations in malpractice lawsuits against professional counselors. Despite the prevalence, many people are often shocked to hear this, yet it continues to be a significant issue in the field. Because of these severe risks involved, sexual dual relationships are strictly prohibited. See that in red? Strictly prohibited. Do not do this. The ethical guidelines are clear about the importance of maintaining professional boundaries for current clients. Any romantic and sexual relationships with clients, their partners, or their family members are prohibited. Additionally, any former clients. Now, here the ACA Code of Ethics prohibits sexual relationships for at least 5 years after the conclusion of treatment. Maintaining these boundaries is essential to ensure ethical conduct and to protect both the client and the counselor. Now, even though this says a minimum of 5 years, I still highly do not recommend this, but just so you know, that's what the ACA Code of Ethics says. To continue this discussion, it's important to recognize that sex cannot be considered consensual in relationships with an inherent power imbalance. Take a moment to reflect on this statement. Sex cannot be consensual in relationships of unequal power. This understanding is critical in maintaining ethical boundaries. Additionally, the Pennsylvania Counselor Association recently changed the 5 year prohibition against sexual relationships with clients to a lifetime ban. This change aligns with the ACA Code of Ethics. And a key takeaway here is that knowledge is power. Once we understand the implications of an unequal power dynamic, we have a responsibility to be mindful of our position and privilege in these situations and avoid any actions that could exacerbate this imbalance. So again, this lifetime ban, I highly recommend that you follow this. As social justice advocates, we need to uphold professional boundaries and ethical standards, adhering to legal and ethical guidelines that safeguard client welfare and promote social justice. We have to act with integrity, ensuring that our values align with our personal and professional selves, striving to do what is right rather than what is convenient or comfortable. Maintaining dignity is going to be crucial, not only for our clients, but also for our reputation in the field. Respect and cultural competence are key for our success, enabling us to continue making meaningful contributions to the field and advancing its mission.